As we approach 2024, many of you are going to be starting on Medicare and going to be selecting supplemental plans. Others of you will be switching to supplemental plans. And you want to make the right choice. But with all the options available, all the different carriers available, how can you know for sure that you have chosen the very best plan for you? In this video, I'll show you how. Now, just before I get into the details of ranking these best supplemental plans, I want to do just a quick overview about the Medicare systems that are available to you. What I mean by that is when you go on Medicare, there's really only two ways you can use your Medicare benefits. Number one, you can have what is called a supplemental plan. These are also called Medigap policies, okay? Or you can use what is called an Advantage plan. These are also called C plans, all right? So those are the two systems available. And there is no best system. It's just a decision you have to make what's going to be best for you, all right? And so let's talk about the details. Now, this is all about supplemental plans in this video, but I want to highlight just real quickly 7 features about supplemental plans that people really like, and frankly, it's why they choose to be on supplemental plans. Number one, when we have a supplemental plan, there's no networks at all, meaning you can go to any provider, any hospital, any doctor, any skilled nursing facility. As long as they take Medicare, they will take that supplemental plan of choice. They have to. No options whatsoever. They take A and B, they have to take your supplemental plan. In fact, you don't even have to ask them if they take the plan. They absolutely will. So that's one feature. Second one is we have no referrals. So if you would like to see a specialist or you want to go to a certain cancer facility, you don't have to have a referral. There's no primary care doctor that's going to make a decision about which specialist you need to see and where you need to be going, because you can make that decision on your own with a Medicare supplemental plan. They have no say-so. Number 3, there's no pre-authorizations. Now, what this means as this is when someone's in a position where they need to have an MRI or maybe a CAT scan or a PET scan, or they need to have a knee replacement or a hip replacement, or they need to go to a skilled nursing facility. In other words, some expensive service that has to be pre-approved by the insurance company. And so when we have a supplemental plan, notice no pre-authorizations whatsoever. In other words, that insurance company that issued that Medigap policy to you has no say-so whatsoever. They cannot interfere in any way. If the doctor says that you need a knee replacement, hip replacement, skilled nursing stay, a CAT scan, MRI, then Medicare says we'll cover it, then that's it. There's no additional requirement from an insurance company whatsoever. Number 4, there's no underwriting, meaning when you first go on Medicare and you enroll in Medicare A and B, what happens is you enter into this period of time. We call this the Medigap open enrollment period. And that Medigap open enrollment period actually lasts for 6 months. Okay, so once we have actually started our B date, sometimes people start A earlier because they keep working and they pick up B at a later date, or if we start B at 65, we have this 6-month window where there's no underwriting. So I can get any supplemental plan of my choosing during this 6-month window. I actually can apply for the supplemental plan 3 to 6 months in advance. But once that B date starts, whatever that is, then I have 6 months where I'm in this guaranteed issue period where any insurance company that's offering a supplemental plan, whatever letter, whatever company in my area, you can choose that carrier, you can choose that particular plan. They cannot deny you. They have to cover your pre-existing conditions. They have to issue the policy. Now, in most states, all but 4, after that 6-month window is over, there could be underwriting involved. But initially, when we first go on, that's our opportunity to get a supplemental plan with no underwriting. Number 5. Also, there's no perks with a supplemental plan. Now, there's a couple carriers that may offer a gym membership or a 24/7 nurse line, sometimes some dental, vision, hearing discounts, things like that. But supplemental plans are pure insurance, and that's the beauty of them. Not a lot of perks by any means, but we have great insurance. Number 6. Notice here, minimal risk when you have a supplemental plan. Why is that? Well, because you're taking the risk of your health care costs, your gaps, and you're transferring that to an insurance company. That's why there's minimal risk. A lot of people are getting a G plan. The only risk they have is the B deductible. So again, minimal risk. And then number 7, we have minimal changes. You realize when a person gets a supplemental plan, it is a lifetime plan. It's also a nationwide plan. If they were to move from one city to another, you take that plan plan with you. From one state to another, you can take it with you. There's minimal changes. Now, the premiums certainly can change, and they will change, and I'll address that here in just a minute. But as far as the coverage is, that coverage is locked in. That plan can really never be changed as far as what the coverage is going to look like with the plan. So we have minimal changes. All right, so those are 7 features that are very nice about supplemental plans. Now, again, I can talk a lot about Advantage plans, other than to say if we take a C plan, in other words, we choose not to do this, but we choose to do that, then everything changes, because the only thing these two systems have in common, I have to be enrolled in A and B to have a supplemental plan, and I have to be enrolled in A and B to have an Advantage plan. But other than that, they're totally different. Why is that? Because if I take an Advantage plan, I will have networks. I'm either going to be on an HMO network or I'm going to be in a PPO network for sure. And those that simply means that some providers are going to take both, some take one, some take none, but it's not going to be unlimited as it was when you had a supplemental plan. Number 2, you absolutely can have referrals on Advantage plan, especially on the HMOs. Why? Because your primary care doctor kind of serves as a gatekeeper to make sure that you really do need to see a specialist, to make sure they really agree that you need to see the cardiologist or to see endocrinologist. In other words, they kind of control all that. Where we didn't have it over here, we're going to have referrals. Also, we absolutely are going to have pre-authorization. Statistically, they say right now about 70% of the services you need on the Advantage plan for healthcare is going to have to be pre-approved by the insurance company. Now, 30% will not. In other words, you can get labs and you can see a primary care doctor and a specialist without pre-authorization. But I can assure you, if you need anything expensive, probably beyond $200, $250, that is going to have to be pre-approved by the insurance company. You're not necessarily going to get that knee replacement or hip replacement or skilled nursing stay that's extended unless the insurance company agrees. That's a pre-authorization. Doc says you need it, but that's not the final word. The Advantage plan has to agree, has to approve of that in order for them to pay for it. And if they don't, you're not going to get that service. So again, no pre-auths. Also, no underwriting. Okay, with a supplemental plan, now what happens, and what I'm teaching on this, is if I take an Advantage plan and I stay on that Advantage plan, so let's say 2, 3, 4, 5 years or whatever period of time, and now I want to get off of the Advantage and come over here back in the supplemental world, now I have to go through underwriting. Which means if you've had any change of health while you're on the Advantage plan and you want to make that switch, if that health issue is serious enough, that insurance company with the supplemental plan does not have to approve you. Remember, they did the first 6 months. But if I take an Advantage plan and stay on that any length of time, year, 2, 3, 4, 5 years, now we're going to have to ask you 25 or 30 health questions. We're going to have to check all your medications, what you're taking now, and what you've taken the last 2 years. And we take that information, we supply that, give that to the supplemental company, and if the underwriter likes what they see, they're all right with your pre-existing conditions, they can approve and the policy. But if they don't like what they see, you have AFib or you're a diabetic with complications, you've had cancer in the last couple of years, but you've had these issues, now that insurance company does not have to take you, and therefore you could be on that Advantage plan for the rest of your life. Number 5, no perks. Now, no perks on SUPs, but when it comes to Advantage, we got all kinds of perks. In fact, that's what makes them very attractive to people, okay? And by the way, I'm not going to minimize the perks. They are the real deal. However, sometimes people buy this insurance because the perks, and they don't think about all these other issues, all right? So we will have perks for sure. And then lastly, we said SUPs have minimal risk. Here, we're going to have more risk if we get sick, especially because why? We have max out-of-pockets. Now, on average, HMOs are going to be anywhere from about $3,000 to maybe $5,000. And I'd say PPOs this year are going to be anywhere from about $4,000 to $7,000, which simply means that you pay copays and co-insurance until you hit your max out-of-pocket. So over here, we pretty much got rid of the risk. Why? Because we had to pay a premium to do that. Over here, typically no premium, but we're still going to pay. We take on the risk of whatever healthcare services we need for that year, and then these max out-of-pockets reset then every January. And then minimal changes. With SUPs, not so when it comes to Advantage plans. In fact, this is the reason why these plans are written for 1 year at a time. These are written for life. These are just 1 year. And the plans can change whatever they want to year. Doctors come and go. Hospitals come and go. Max out-of-pockets change. There's just factors within these Advantage plans that change. And so we definitely are going to have some maintenance that's involved. And it's not really tied to you. It's tied to a service area. So we leave one state and go to another. You're not going to take that plan with you. You're going to have to find a new plan when you relocate. All right. So those are some of the features and the differences in these two systems. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, now let's focus in on these supplemental plans so you can see really what you have to be considering to make the right choice for you. First off, I want to note that there are 10 standardized MedSup plans on the market today. Now, many of you, 8 of these letters you can get, 2 of them you could not, which would be the C plan and the F plan. I'll explain here in just a minute. But here's the point. We have 10 supplemental plan options, and what I want to teach you about is this word standardized, which means each of these letters is a different Medicare supplemental policy type. Okay, each of these letters represents a different supplemental plan that's available to you. Now, I will tell you this, some of these letters are not available in certain markets, certainly not by all the carriers. So these carriers only have to offer certain plans, and beyond that, they get to kind of pick and choose. So my point is, even though I show you 10 letters, again, they're not going to be available in every market, and certainly not carried by every single carrier. So when we talk about standardization, it means this. Medicare sets all the rules for what each of these plans are going to cover. In other words, Medicare sets the rules saying this plan has to cover this, but doesn't have to cover this. Over here, like for instance, like on a K plan, the K plan only covers 50% of certain services. You'd have to pay 50%. L plan covers 75%, and you'd have to pay the 25%. So it's a different percentage. For instance, like the A and B plan, very minimal coverage. There's a lot of gaps that are simply not covered by those plans. And so the point is we have these different letters because each of these letters is going to cover different types of services at different types of amounts. And so there's rules, and Medicare sets the rules, which means, let's just use the G for the example. The G plan, whether I were to buy that from United Healthcare, or I bought it from Mutual of Omaha, or I bought it from Aetna, or I bought it from Cigna, or I bought it from whoever, it doesn't matter. If I buy that G plan, because it's standardized rules by Medicare, there would be no difference as to what's covered, what bills are paid, and what bills are not paid. In other words, we have identical coverage because Medicare says to you, the consumer, when you buy that G plan, everything's going to be covered regardless of what insurance company you choose other than the B deductible. Okay, so that's going to be the same. So we would never select a plan or a company based upon thinking that, that company's going to pay better than another. That doesn't happen. They're all going to pay the same bills, the same type of bills, and the same amount of bills based upon whatever letter you purchased. Okay, so that's what we mean by standardized coverage. So Medicare sets the rules for what is going to be paid and not paid. Now let's take a look at the top plans. So as we look at these top plans, again, we have the 10 letters. Why do people buy them? Well, they buy them because in original Medicare, A and B, this A and B system, A is inpatient, B is outpatient. A is going to cover hospitals, skilled nursing. That's going to cover hospice. B is going to cover doctor services, whether that's in or outpatient. It's going to cover durable medical equipment, outpatient facilities, outpatient surgeries, those type of things, as well as home health care. And so A and B cover different things, but Medicare doesn't cover anything 100% other than preventive services. So every service we get beyond preventive services, we're going to have some kind of financial out-of-pocket, some liability, and so we call those gaps. And you'll notice we have 3 gaps on the A, and we have 3 gaps on the B. And so what we have on the A side is we have a deductible. By the way, this year, I'm shooting this video in 2023 here in October, but that is going to $1,632 deductible on the A in 2024. Now, hospital copays. This means if I'm ever in the hospital longer than 60 days, then I start getting into hospital copays, and those go up pretty quickly. They are $408 to $816 a day in the hospital, month 3, 4, and 5. Hospital copays don't happen a lot, but when they do, they're very expensive. Skilled nursing facility, this happens days 21 to 100. We have a daily copay in 2024 of $204 a day. So these are daily copays, all right? And so my point is, this is what you're responsible for on Medicare A. The B side of Medicare also has, as you'll notice, 3 gaps, 3 liabilities. The deductible this year, 2023, is $226. In 2024, it went to $240, and and this is an annual deductible. Coinsurance is that 20%, so Medicare pays 80% of the bill. You're responsible for 20%. And then excess charges do not occur often. It's rare, frankly, less than 5% now. But the point is, when you see a doctor that adds to the bill, the most they can add is 15%. And when they do that, you're responsible to pay for that. All right. So my whole point is, these are the gaps in Medicare, 3 on the A and 3 on the B side of Medicare. And so as we talk about the top plans, we're talking about how are these top plans going to cover these gaps. All right. So the top plan right now, as far as coverage would be concerned, would be your F plan. Now, before you get real excited about the F plan, just know that several years ago, Medicare began to phase out the F plans. Now listen, there are millions of people who have F plans, and they did not lose them. They can keep them for the rest of their life. But the rules are now, if for someone to qualify for an F plan, they actually had to be eligible for Medicare prior to 1/1 of 2020, prior to that, which means basically they were born before January 1st, 1955. They could still get an F plan, and they can keep that F plan for their whole life, okay? Now, why would they do that? Why do some people do that? Because that F plan fills in absolutely every gap. 6 of 6 covered by the F plan. So as long as Medicare pays first, that F plan will pick up all the balance. So I have lots of people that are on F plans still, and we tell them, if you ever get a bill, don't pay it. There's got to be some kind of a problem. Either it's a coding error, or maybe you did something Medicare is not going to cover. But as long as Medicare covers first, all the gaps are going to be filled in by the F plan. Again, most people can't get that. Now, the C plan would be in the same boat, except the C plan did not cover excess charges. And again, you'd had to be born before January 1st, 1955 to be able to get that plan. So those two plans, for the majority of you, are going to be off limits. Now, I would say this to those of you that may have been born before January 1st, 55, or starting Medicare before 1/1/20, the F plan today would still be available to you, but it's typically not a real good value because what's happening is you're really overpaying for that full coverage. All right, and so, but that is a top plan as far as coverage is concerned, would be the F plan for those of you who would be eligible based upon your birth date. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner, and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions, and they'll show you different Medicare options to make sure that you're confident in the decision that you make. All right, so now let's talk about the plan that really has replaced the F plan as far as coverage is concerned. So this would be for people that are born after January 1st, 1955, right? You can get a G plan. It's the one that's the most comprehensive coverage today. Certainly eligible for that as long as we're going to Medicare 1/1/2020 or after. The G plan would be available. So again, it's going to cover lots of things, but it's not going to cover everything. The F covered the 6 of 6 gaps. The G covers 5 of the 6 gaps. So that G plan, if that's what you were covered by, is going to cover everything on the hospital side. So it would not cost you a penny for anything in the hospital, any in a skilled nursing stay. All that's going to be covered by that G plan. All gaps filled in. On the B side, what the G will pay, it'll pay your full 20% coinsurance, and it'll pay excess charge if and when that occurs. The only thing the G does not pay would be your annual B deductible. Remember what I said? This year, that's $226. 2024, it's going to be $240, and that is once a year. That's it. So the first $240 is going to end up as a bill in your mailbox. That could be a couple doctor visits covered through the B. It could be an MRI. It could be a cataract surgery or some kind of outpatient surgery. You pay the first $240, and then after that deductible is met, then it's going to cover everything else. All that's going to be covered both on the A and the B except the deductible. And then that B deductible will reset every January. So whatever it is, you'd be responsible for that if you had the G plan. And so again, this year it's $226. Next year it's going to be $240. So that's the G plan. Again, selected by many today because it's comprehensive coverage. It's the best they can get since the F is no longer available for most people. All right, so that's the F, that's the G, and now let's talk about the N plan. The N plan is also popular today, and the way it's going to work, again, is filling in the gaps. So the N's just like the F and just like the G, and then everything on the A side of Medicare, anything that would be billed to you by the hospital, a skilled nursing, hospice, all those things, all those gaps that exist here are going to be covered by the N plan. Okay, now on this side, it only covers one of the gaps. All right, so what it'll do, it'll cover that full 20% coinsurance, which is really the big gap, but it will not cover the B deductible. Remember what I said, $240 in 2024. okay, once a year. And then if and when you ever had an excess charge, if you did, again, it doesn't have to happen very often anymore, less than 5% when it happens. But when it does happen, if it did, then you would be responsible for that additional 15% that the doctor is charging. Then in addition to that, what they also do on the B side is you have 2 co-payments. One of those is if you go to any doctor, you're subject to a $20 copay. It's the most you can ever have a copay, $20 to a physician. Or if you went to the emergency room, you'd be subject to a $50 copay. All right? And so what happens is the premium is going to be a little bit lower, and you're just taking on a little bit more risk, and you're taking on a couple copays. But again, some people like the in plan. So again, those are your top plans. I'm not saying that's the best for you. I'm just saying to you, the majority of people today that are buying supplemental plans are getting an F, the G, or the in plans. All right, that brings us to our last item, and it's really this question that you have to answer: how to decide what's best for you. All right, and so really there is no best for everyone because one size doesn't fit all the Medicare. And so you have to decide what's best for you, but I want to share with you a couple things that I at least would think about as I think what's best for me. Number one, what's the coverage look like? Now, we know that these are standardized plans, so regardless of what carrier you go with, whether it's an F, a G, or an N plan, a G is a G is a G as far as the bills are concerned. It's going to pay all the same. An N is an N is an N, and F's an F and F. It won't matter as far as carrier goes. Why? Because that's standardized by Medicare. So what you have to decide, now let's say you can't get the F because you're born after January 1st, 55. If you get the G, you have 5 or 6 gaps covered. You only have to be 1 gap. Someone say, well, I'm all right with a little bit of a lower premium. I'll take on a little more responsibility. So you have to be comfortable with knowing that it covers 4 of the 6 gaps. You got to pay the B deductible excess. And then remember, you had some of the copays. So that's really what you have to decide. What kind of risk are you comfortable with? All right. And so that's going to matter. So decide, first of all, how do you want your insurance to work? Are you concerned about certain items? And you want to make sure you get those covered. All right. Number 2, then I'm concerned about cost of initial premium. In other words, what's it going to cost me? Now, this is very important in that we're going to have some type of a premium, and I will tell you that right now, on average, you're looking at F plans probably in that 150 to 175 range. G plan going to be in that 125 range. The N plan is going to be around $100, maybe $90 to $100. So as we move from F to G to N, we're going to reduce that premium for sure. And so you just take on a little bit more exposure. But we always care about that initial premium. In other words, what am I going to have to pay that first year? And I care about that. But I will tell you this. This is not the most important thing. It matters, but it's not everything. And here's really what matters is what is the cost long term? Cost long term, which means what? All premiums are going to go up. Everything goes up. Even Advantage plans go up, max out of pockets, and sometimes in copay. So everything goes up because of medical inflation. And so what I care about is the long term. Yes, I care about my initial premium, what's going to cost me the first year. But what we want to do is we look at the stability of the company. How stable are those rates? Because we find that stability is more important than first year. Why? What's it going to look like in 3 years, 5 years, 10 years down the road? Well, the truth is no one knows that. But what we can do is look at each carrier and see how they have raised premiums in the last 10 years, how often, how drastic were the price increases. And so as we look at the last 10 years, we think typically history is going to repeat itself. And so we look at companies that were stable before will probably be more stable in the future, which means larger carriers, carriers that have a larger market share. Why? More people that are in those groups end up being more stable over the long haul. I'll give you kind of silly, but a very good example. If someone is in a canoe in the ocean, that canoe is going to feel every single wave that hits it. Why? It's a small boat in a huge body of water. But if I'm in that same ocean and I'm in a cruise ship, and I get in that cruise ship and I hardly even tell I'm even in the ocean. Why? It's a large vessel in a large body of water. We just don't feel the impact of the waves as we would in a canoe. And that's what happens with supplemental companies as well. Some are smaller. Regional carriers don't have as many people in the group. And if there's a lot of health problems in that group, you're going to feel the pain of that because there's not enough policyholders to spread the risk out. So when we look at stability, we're looking for companies that have a larger market share, that have proven over the long haul to be very stable because, again, prices will go up, but some companies go up more frequently and more drastically than others, and so you want to go with a company that is very, very stable. So these are the things that you have to consider as you decide what is the very best plan for you.